I'm here today with Val Morrison, who's scientific advisor at the National Collaborating Centre for Healthy Public Policy. Val's work over the past 15 years has focused mainly on health inequalities in three different areas: intersectionality, policy approaches to reducing health inequalities, and wicked problems. Let me turn to your personal path a little bit. Is there anything you can tell us about how you personally got interested in, inspired by, started in this field of well-being or the movement to prioritize well-being policy?
Well, it comes through my work at the National Collaborating Centre for Healthy Public Policy, and really, this is something probably more so than any other single topic that we work on that's connected to the global pandemic. As a shop that focuses on healthy public policy, we're always sort of looking out for new policy tendencies or new political tendencies that we see emerging that impact or may impact health. And so we saw with interest the adoption in New Zealand of the first large well-being budget, being called a well-being budget. And then a year after that, with the pandemic, there was really a ton of activity in the press and in the academic publications about the promise of tying well-being to the budget-making process and to the policy process. And so we started to explore that. And this was happening, as you recall, in the couple of waves, the first 6 months or so of the pandemic, where people were seeing that perhaps another way was possible, and that the slogans like "Build Back Better" were being used by governments as well as by academics and in the popular press about how we can maybe reprioritize things coming out of this pandemic and change the sort of the way that we think about the basic building blocks of our societies. And I found it particularly inspiring because the areas that I concentrate on, the main one is in what we call health inequalities. So those inequalities in health between social groups that are not inevitable, that are created by policy and social and political and cultural choices that we make. And shifting the focus, I think, from health, which many people understand in terms of the health system and of hospitals and sickness and illness, shifting to well-being allows us to focus on the same things, those social determinants of health and those political and social and cultural decisions that we make that affect health. But it clearly states, or maybe doesn't state, that we're not talking about health, illness, and the medical system. We're talking about the things that make up our ability to lead full and rewarding, healthy lives.
How has the momentum towards a well-being policy approach affected the National Collaborating Centre for Healthy Public Policy's work?
Well, as I said, we began a project alongside, we usually have 8 to 10 ongoing projects at any given time on things like analyzing public policies, public health ethics, health in all policies, health inequalities, etc. And we brought this one on board because we saw it as potentially something that might move the needle in terms of working on policies that are not necessarily related to the health system, but that have an impact on health, what we call healthy public policies. So it's affected our work in one way that's kind of curious. If we've had these parallel developments over the last few years of the development in the work that I and one of my colleagues for a portion of the time were doing related to well-being, and my work with you and others on the Canadian Wellbeing Knowledges Network, and also developing at the same time other people in our organization developing a Canadian network for health in all policies. And there are a great number of parallels between well-being policies and the approach that's called health in all policies that comes out of public health. So in a sense, we've been going along these parallel paths and working towards developing these notions. And perhaps that has led us to come back to each other every now and then and say, what really is the difference between health in all policies and well-being? But the difference as we see it, and perhaps one of the areas of promise for well-being policies that's different from that of health in all policies, is that well-being policies have not been led or dominated by public health actors and public health discourse, whereas health in all policies is something that emerged directly out of public health. So we see these as kind of parallel paths, and it's led us, especially between those two projects, but not only, to talking about, how these two approaches are related and how we push them both forward as we move into the future.